The aim of the project is to try and reduce the patients coming into hospital when they don't need to. For those patients who have had a fall and perhaps haven't been injured, they're at risk of what we call a long lie, which is staying on the ground after a fall for anything over an hour. That can be really detrimental for people, especially for those over 65 and older.
Previously, we've only ever had the option for dom care agencies to call an ambulance, so enable to kind of give people in the community across Swansea the opportunity to not need an ambulance or not need to go into hospital. We decided to pilot this idea. The idea came from an OT who works in Swansea Council. So the OT has kind of helped us with learning about the iStumble app. So the iStumble is an app that's available on anyone's phone. It was created by the Welsh Ambulance Service and Wingcare, and it basically is a risk assessment tool, and individual using it can work their way through a series of questions, and at the bottom it then tells you if this person is safe to lift. Simply Safe have been talking to us about this for a couple of years. They've been very keen to trial it, and we were able to get some regional funding to buy a piece of equipment called a camel, and that camel then enables people to be lifted in the community. And then we've worked with Welsh Ambulance Service and the falls prevention team to enable them to get training and build the resource within Simply Safe. In terms of social services, it stops people coming back through the system and needing another package of care. They remain with their current provider and they're able to just be as independent as possible without having the disruption of needing to go into hospital or have an ambulance arrive at their home.
From a Simply Safe perspective as well, because we work so hands-on with the patients, we've seen the emotional impact it's had on them as well. So it's allowed our clients to gain confidence in the service that they're receiving, knowing that they've got somebody familiar on the end of the phone that's going to respond to them if they have a fall. It has built their confidence in confiding in staff. So prior to the team, we'd find that clients would potentially have a fall and not want to disclose that in case of a hospital admission.
For that person, we're avoiding all of the health issues that a long lie can cause, which includes all sorts of things: deliriums, cognitive impairment, kidney damage, dehydration, malnutrition.
The staff have a lot more, they feel like they've got a lot more autonomy and that they're a lot more aware of falls, so they're constantly looking for soft signs, they're looking for potential infections, and they're making us aware so that we know to keep an eye on that client and we know that there's a potential fall come in.
So we can't do it alone in health, so bit Amy's hand off when she said she was keen to look at this project and take her idea forward. The fact that we then had Simply Safe already involved was fantastic and have been a great asset in terms of actually doing the doing and getting things progressed. The learning has been great. We've got access to some experts that have been really open and flexible with us, asking questions and getting some sort of expertise on board with how we move through any kind of quality improvement project, and has been good at keeping us on track for what it is we need to do to make sure that we don't rush to expansion, but really make sure that what we're doing in the first place is solid and that we've got a good foundation to be able to then move on with confidence. We've started small for a good reason. We want to get it right before we expand, but there's opportunity to support 1,000 plus patients in this situation, whether they receive domiciliary care or whether we look to do similar projects within our care homes and our nursing homes. We've got, there's a huge population out there that could benefit from this service, and the more we support people in the right place, in their own homes, keeping them away from our secondary care services, the better.